Electrolyte is nutrients in the body. Magnesium, calcium, vitamin A, all these nutrient level in the blood. If there's enough nutrient, the body can also fight against cancer. Okay, so that's what you're going to find out if there's nutrient level is enough or not. Okay, liver panel. Cholesterol, protein, albumin, globulin, bilirubin, SGOT, SGPT, GGPT, ALT, ALT. And I included all the hepatitis A to Z, and alkaline phosphatase. Bacterial panel, okay, this is where we find out if there's bacteria in the blood. H. pylori, streptococcus, chlamydia, legionnaire, Lyme's, syphilis, all these bacteria can cause cancer. Okay, we're gonna test your thyroid panel. Now, thyroid is very important in regulating the hormone system in the body, very important in giving us the energy that we need. Thyroid basically connects every single organs to our body. If thyroid doesn't work, then the organ doesn't work. Our body function just went downhill. Okay. Now most doctors, they only test TSH or T4 or T3. That is just not enough. Okay. We gotta do everything. T3 total, free T3, free T4, T3 uptake, TPO, TPG, FTC, calcitonin. All these are important. Everything I mentioned here, you gotta make sure that you get it tested on. Okay, if you don't test through me, you gotta tell your medical doctor to do these. These are very important. Every single means something. For example, TPO, TPG, these are antibodies. You wanna find out if your immune system is attacking your own thyroid. If it is attacking your own thyroid, eventually the thyroid is gonna go cancer. Eventually your medical doctor is gonna say, cut it, because this cancer grow on the thyroid. So why don't you just test it now and prevent it from happening? Prevention should be the primary issue that help you to fight against cancer. Prevention. Okay, if you don't prevent your organs from getting better, the cancer is going to spread very, very fast like a wildfire. Okay, autoimmune panel, we talk about immune system, right? IgG, IgM, IgE, interleukin 1, 2, 4, 6, 8. T cell, total white blood cell, total lymphocytes. Count CD3, CD4, CD8, CD4, CD8 ratio, CD19, natural killer cell, homocysteine, total hemolytic complement, CH50, C3 complement, C4 complement, ntDNA. Okay. Every item needs to be tested because these are the marker for the immune system. Okay, if we find out anything that is not right, we need to take care of that particular marker to make sure your immune system are up to date. Make sure immune systems are strong enough to fight a cancer cell. Okay. Parasite panel: toxoplasmosis, amoebiasis, parasites, fungal. Candida, Aspergillus, these we're going to find out for you as well too. Viral panel: rubella, mumps, varicella, cytomegalovirus, herpes 1 or 2, parvovirus, HIV, Epstein-Barr virus. Okay, gotta make sure you have no viruses. Virus has to be clear in order for the cancer to get better. Okay, hormone panels. Okay, estradiol, estrogen, LH, FSH, prolactin, testosterone, HCG, gastrin, ACTH, cortisol. Okay, every single item on the hormone panel has to be tested and make sure they're normal. Okay, now those are regular standard blood tests. Sometimes we require patients to do something extra if the cancer cell if your cancer is in a very dangerous state. Okay, we also tell patient you might go to the Cyrex laboratory to get to test your gut function, to test your gluten reactivity, to test your cross reactions such as if you have reaction to corn, rice, potato, coffee, grain, dairy, soy, eggs, chicken, and others. Now, if you have cancer, your immune system is down to 2. Okay, when your immune system is down, you are allergic to every single food. You're allergic to a lot of food, and if you do not know that, for example, if you're allergic to soy, if you do not know that, and you keep on eating soy, tofu, whatever, then your cancer is going to grow. If you keep on eating potatoes, and you don't know that you have reaction against potato, eventually the potato allergen is going to attack a certain part of your body. And the cancer is going to get worse and worse and worse. Okay, these are very important tests that we do for patients. And autoimmunity as well too. Okay, there's organics test that we sometimes recommend to patient. What it does is it helps you to test your fatty acid, carbohydrate, energy production marker, B complex, methylation cofactor, neurotransmitter, and detox marker. This is one of the few tests that test for methylation and the neurotransmitter. Methylation we talk about is genes that turns on off the oncogene and the tumor suppressor genes. Okay. Neurotransmitter is part of the brain that sends signals to our organs, to our body, to our blood vessels, just kind of overall signaling for our body to get healthy. Okay, those neurotransmitters are very important as well too. Stool test, so you go to the bathroom, you poop, and you bring the sample to this laboratory to test for parasite, mold, fungus, yeast, bacteria, and virus. That's just another way to test. Okay, we want to make sure that we do a lot of different tests to find out in detail, what's causing these cancer. We gotta find it out for you. How to find that out? Okay, methylation. Okay, this is a very complete methyl test to test your genes. Okay, some people say that cancer are they pass it down from your parents. Okay, that your parents has bad gene and you get the bad gene. If your father has lung cancer, you might have lung cancer. This is how we find out if you have that or not. Okay. 5-methyl THF, glutathione, SADL tetrahydrate, folate, folic acid. All these are very important testing. Okay, so you go to the professionalcoop.com. So we'll teach you how to do that. Okay, to find out your genes, to find out if your oncogene it's good, if your tumor suppressor gene is good. We got to make sure of the gene if they're functioning good or not. Okay. We also do the Chinese pulse system. So patient comes in, I touch their pulse, and I determine using the Chinese method of which meridian has issue, whether your body has fire, wood, earth, water, metal issue. We're gonna test. We're gonna pulse your organ to make sure organs are healthy. We're gonna pulse using pulses to test your blood, your qi, your energy level. Okay, your joints, your organs, your whole body energy. Okay, and these are important. Once your body energy is strong, the body immune system just comes up. Okay, this is another method. Another method, again, never ever depends on just one or two or three methods of therapy. Always multiple ways to check, always multiple ways of therapy, always multiple ways of looking at different things. Never just one doctor, never just one or two treatment, never. Okay, another way we test your blood is to, we call it live blood. We take one drop of your blood and put it in the microscope and we look at your blood. If your red blood cell is normal, it's beautiful, or if your red blood cell is distorted, cancer, okay, or bacterial infected. We want to see if your red blood cell is nice and open and round, or if the red blood cell is clogged up. Okay, all this information give us, all this material give us information on how to help your body to get rid of cancer. Okay, we do not treat cancer. I gotta claim that. We help your body to get healthy. Your body will kill the cancer. Right? The blood, that's one of the very important ways. You gotta find out your blood. Your blood has to be clear. Your blood has to be individual. Okay, your blood has to function really, really well in order for your body to be strong to kill the cancer cell. Okay, so how am I different? How do I take care of these cancers? Like we just mentioned a bunch of different causes, right? We just mentioned a whole bunch of different ways to find out you have different causes of cancer. Now how do we address that? How am I different from other alternative practitioners? How am I different from traditional chemotherapy? How am I different? Okay, so very first thing that we do is we take control of your diet. We control the food you eat. We will tell you what to eat, what not to eat. Like we just mentioned, we got to find out what food is good. If your food is no good, you'll cause more cancer. So we need to tell you what's good and what's not good. We need to avoid sugar, avoid certain food, avoid GMO food. Okay, avoid food that causes inflammation. We'll give you detailed information on what to do. Juicing. Okay, that's very famous for a lot of patients out there. who's doing juicing by themselves. Okay, it's great. Definitely continue with that. Some people just doing juice, the cancer is gone. Okay, why? Because juicing addresses our pH level. Juicing clears our system. So what is juicing? You juice the vegetables. You juice carrots, cucumbers, celery, apples. You put a juice and you just drink the juice. You don't eat a lot of meat. You don't eat a lot of different carbs. You just cut all those and just drinking juices. And this is one of the primary diet that we have to recommend patients to do this, especially you got cancer, stage 3, stage 4. Okay, you gotta do this. Okay, this will be your meal. Okay. Coffee enema. Some people does it, some people don't. This is very good way to clean your gut, your small, your large intestine. Basically, what it does is they put the coffee, special kind of coffee, and there's a tube in there, and you put the tube right in your anus, and just flush all this coffee down, and you poop it out. Okay, help you drain off all the unnecessary, like we said, accumulation of toxin, fungal, and parasite and bacteria within your digestive system, and just flush it out. Okay, it's a very good way, but just a lot of work. Very tedious. Whole food supplements are important. Like we talk about, the food nowadays are just so depleted, no nutrient. Okay, and there's no enzyme in our gut system. There's no antioxidants, so the free radical grows rapidly. And our organ has no nutrients, so organ have no function. Your liver, your kidney, spleen, pancreas, colons, lung have no nutrient, have no function. So we gotta give you a lot of food supplements. And these are food-based supplements, which means the supplements are made from food. It's different from the chemical supplement you buy at the Costco, you buy at Rite Aid, you buy at Walmart. Okay, I really recommend you do not buy those chemically made supplements. Vitamin A, vitamin B, vitamin C, these are chemically processed supplements. They're not real supplements, they're not real food, they're not real nutrient, man-made. Okay, what you want to buy is naturally whole organic food supplements, which if you come to me, I'll recommend it, the right supplement for the right organs, the right supplement for the right body type. Okay, it's very important that we have a design supplement for your condition. Even if you buy the wrong supplement, even if you buy the food supplement, you buy the wrong kind, your body doesn't like it, the cancer will still grow. So every time patient comes in, we design a supplement program, herbal program, for them to bring home so the body can get the nutrient. But it has to be the right amount, the right kind of supplements. Okay, homeopathic is another kind of remedy that we help the body system, okay, to filter out all the toxin material in the body. We also use Chinese American herbs. And we mostly use American herbs because American herbs are local herbs. Local herbs are for local people. Chinese herbs, I don't like to use them as much because they are imported from China, imported from other Asian countries. They tend to have more toxicity. Okay, but if you found the right herbs to eat, the herbs can eliminate a lot of bacterial infection, viral infection, fungal infection, can take away the hormone issue, can release your constipation, can improve your immune system, can heal your white blood cell, your red blood cell. The right kind of herb is very, very important. Like I said, I will combine the right herbs for you, the right whole food supplement for you, the right diet for you, in detail, which is only tailored to your condition. And you're gonna see huge improvement, huge. Okay, other machine that we use laser. There's two kinds of laser. One is the low-level cold laser. Another is high-level hot laser. Why? Because a lot of patients, when they come in, they have pains and aches and pain, right? Cancer patients have bone pain, muscle pain, nerve pain. We have to use this machine to heal the pain. Okay, at the same time, because the laser help decrease inflammation, help increase circulation. At the same time, the cancer gets better because inflammation is gone, because circulation gets better. Right? We use Rife therapy. Rife therapy has certain frequencies. Okay, particular frequency will help to kill and destroy the bacteria, virus, fungus, and parasites. Okay. There are much more information on YouTube. I want you to go to YouTube and search Rife. Search Rife. And you'll find bunch of good stories on YouTube on how Rife help with cancer. You'll find it yourself. You'll search it yourself. I really encourage you to do that. Please do that. Okay? But this has been a big help in reducing the cancer symptoms and the causes of cancer. Okay? Like I said, we do not treat cancer. We do not use machine to treat or heal cancer. We don't. Okay? These machines are aimed to help you to address these multiple layers that causes cancer, every single issue, whether bacteria, virus, fungus, inflammation. These machines are aimed to address those issues, not to kill cancer. Okay. All right. Detox. This machine, HIFUMAN, will help you to kind of help drain all the toxicity from your body and drain it to the lymphatic system. Okay. So your lymphatic system can drain away the toxin to your poops, to urination, to you get it out of your system. Okay, that's what this machine does. It's very, very good. It opens up your lymphatic channels, increase your lymphatic circulation. It's a very, very good machine. Okay, now PEMF. Remember we talked about the electricity, the good and bad electricity, right? If you stay under electric pole, if you use the iPad all the time, if you sleep with your iPhone, the bad electricity stays in your body. Remember we mentioned that. Now, one of the only way that we help patients with that is we call it PEMF therapy. PEMF stands for pulse electromagnetic field. Again, pulse electromagnetic field. What it does, this is a good natural electricity, which is kind of represent the storms. You know, when it rains, electricity comes down. The lightnings, that's the same lightning as it is produced in the machine. The doctor, I think what's his name? I forgot his name. A doctor about maybe 40, 50 years ago, he found out while he was experimenting with this electromagnetic device, and he used it accidentally on a friend of his that has cancer. And for some reason he used that, and after maybe 10, 30 sessions, the cancer it goes away. So that's how he found out, and he started to study this machine deeper and deeper and deeper, and now it's produced this system. We call it Magma Charger Pro. Okay. It helps your body to generate the good natural electricity, and then our body is like a battery. Right? And the battery has to recharge, right? When the battery is full, it just works really well, right? It has all the energy. Our body is like a battery, so if our body is charged with good electricity, I mean, you're gonna have energy. You are going to feel like you're in your 20s. You want to go sporting, you want to go hiking, you want to do things because your cells are just full of good energy, and that's what this machine produces. Okay.